Our next speakers are wonderful individuals. Many of you probably already know. Krieg and Eunike Velleuer Carlberg are providing oral inspections throughout the weekend and will now be giving a talk on screening, awareness, and self-care for cancer in FA. Krieg is the executive director of the German Fanconi anemia support group and a bereaved FA parent. And Dr. Velleuer Carlberg is a pediatric hematologist oncologist in Düsseldorf, Germany. They are now known as the Cancer Awareness Team, aka CATS. Thank you both so much for being here on behalf of all of us. Thank you.
Don't want that.
I got the power. We have the power, or if not, we try to get the power, right? So that's why we start with a little intro, an active intro to be powerful. So I will show you a power exercise right now for stress relief. Just maybe in the next 2 minutes more people will come, so we will fill up the time. Take your right arm, go like that, make a fist, and squeeze your complete arm. The forearm, the upper arm, and the fist. Squeeze, 5, 4, 3, 2, 1, 3, and feel how it feels. 10, 9, 8, 7. Let's say you go to a doctor's office and you wait there and you have a lot of fear. Then you just go on and go like, you can do this a little bit hidden, like only take these big muscles here and go like, Argh! And then relieve, and you will see the hormones, the stress hormones will be balanced, and this is a really good exercise. Okay, ready to go. Okay, nothing new, right? We know this. People are getting older, hooray, the buts. Transition of care for the adults is mostly complicated. The high risk is really mostly overwhelming. Ignorance as a strategy. We really, with a lot of tears, sometimes see this. And what do we need? Better solution for guidance and support. We try to change the game for us all. And the things we think which change the game is increase awareness, enhance knowledge, expand the options for early screening and diagnosis for both the medical field and for the patients with Fanconi. So increase awareness, enhance knowledge. Sherry and FCF has prepared wonderful things, so I don't get in detail in this, and you also have seen this in the last year. So the overview about what is to do for not oral screening, of course not only for screenings in total, and especially today we want to concentrate in oral and mouth. Eunike?
Originally we had planned a game with you now. We will make it a little bit short now, so I need 7 dedicated Fanconi anemia individuals or caregivers up here. It will be
the 7 here are the lucky ones.
7 people. You can come up here and please stand here. So many of you might have listened to my lectures and to Christine's lectures for several times. And those of you know that I always show one picture all the time. I love this picture very much because it explains a lot. And we learned that only seeing or looking at a picture is not enough to bring the knowledge from your retina to your brain, to your gut, to your understanding, and that's why we switched gears and we tried this for the first time in Denmark and it worked perfectly fine. So we have now 7 voluntaries here on stage and each one has a paper. Can you please turn your paper around? I know it's a little bit tiny, but maybe all of you can see they have pictures from the oral mucosa, like a schematic drawing that I put a lot of time in drawing. And now it's up to you to bring this in the right order. We begin here at this point. Who should be here? Smart. We have some very smart people up here and down there. Perfect. So, I'm first. It's getting better. So I think you made a little mistake. Perfect. Thank you. Hast du den Clicker? For those of you who cannot see this from the back, this is what they have here now holding up. What's your name?
Brenda.
Brenda, I'm very sorry. You have wonderful hair, but we do not want to talk about you, so you can just leave this there. So cancer is something that we today do not want to talk about. Who? A cancer prevention training without talking about cancer? This is really important. Cancer treatment, as you know, is really a challenge. And we can do much better if we catch the cancer early, if it's not an invasive cancer or even only a little bit of dysplasia. So normally we should we play this game a little bit from the idea of when can you see something, when you can treat something, but in the interest of time, I think we just say, you both can also sit down because you're in good shape. Thank you very much. So these tools are addressed in Agata Smokosevska and Tamar's study to characterize those cells, but these are not cells for screening. Screening is something where we see a difference. And this is something that we see here in Daniel's case, in Eagle's case, Jessica, and Christoph. I mean, I know you already for a very long time, but this is already cancer. It's cancer in situ. So this is also something what is the last minute before it becomes to real invasive cancer. So if you have this detected, then you are lucky. But actually, we also do not want to talk about that anymore because we need to be further down there. So thank you very much. You are allowed to sit down. You can see here, that's why we sent Christoph back home and to sit down. This is something what we call the point of no return. After this point, cancer will become invasive and it's very difficult to treat. So we want to be here. These three things are the ones that we want to catch. How can we do that? Let's move further. Thank you very much. A big applause for our three screening boys and girls.
We have talked about this on and on and on, as you probably still remember from the last year. So what we want to have for the future model is that you go to your doctor on a regular basis, twice or 4 times a year, depending on how your oral cavity looks like. And we also want something to add on. It's the self-examination of the oral cavity. The idea is that if it works together, then we can catch changes here in these 3 states. And if we're not aware enough, it will happen that it develops to this direction. But we have time in development, and that's why we can use the time for early detection, not of cancer, but of changes of lesions. We have developed wonderful material, teaching material. You can find everything on Fanconi.de/iCare, but there will be a QR code, so later on you can take a little thing, you can take the QR code. There you can find the teaching material. We have produced a wonderful video about oral self-examination. You can take a look at to understand why it's so important and how it works. And also we have the resource that we have something like a lexicon, like a Wikipedia, where you can look up something about oral cancers, how they develop. And of course we have developed, as you know, this wonderful super app FA-Exam, which a few of you have already experienced, that you got trained via NIH or our project. So this is what belongs to this process. So now we have to get ready. We are the CATS team. We have something special prepared. Oh my God. You can call us anytime with anything, anytime. When we have some questions about cancer awareness in any case, you can contact the CATS. It's fine. It's warm in here. And the shirt is as long as that. So the Cancer Awareness Project, as I just described, from 2020 to 23, we developed all these materials together with the complete community. A few of you probably remember that. So we have involved 90 Fanconi adults from all over the world in development of these materials. So it's not our idea, especially, it's the ideas of you and you and you being in the project and developing this together with us. And now, since this year, actually, we are the Cancer Awareness team, and we try to motivate, to inform, to be your partners. We are not your judges, we are not your doctors, we're just your partners in this whole game. We are connected to you with our complete heart and want to make a change in this whole story here. As you can see, it's basically what we have said about these projects. And in 2022, if some of you were here, we have already started with presenting this idea. And that days we did an oral self-examination workshop. I don't know if you remember, we all had these mirrors and we're looking in our oral cavities. Last year, we did the basics of oral mucosa, changes in oral mucosa. It was kind of a quiz. You were sitting together in groups and discussing how do changes look like, what are lesions or not. I don't know if you remember, if you were here. For this year, we have prepared a workshop because we have some kind of challenge using the app. It's especially the challenge taking good pictures. So now we would like to introduce you a version of a Danish version of Daniel, the DD version. Well, you know, we have this questionnaire. So in the past, we only were asking about, do you drink or do you smoke? Not that we judge about that. We have widened the questionnaire with more questions to find out more reasons why lesions could develop or not. And so we also have opened this emotional dimensions and psychological dimensions. After you have had your personal training here, so when you are in the screening room, we will have the oral examination, we will do a video. Out of this video, we will pick a picture of a lesion, which you can follow in the following months. And we will show you how the app works. We will go through the complete process and how you can share the PDF, which gets produced in the app, with your doctor or with your whoever person you want to share it with. In 3 months, we would meet up again with you on a virtual base to hear about your thoughts, if it's working or not, if you have problems or not. And then 3 months later, we will meet up again. So we just want to assist you. We don't judge nothing. So it would not be nice to meet up again and just to hear what you think, what's working or not. And maybe we sometimes see some changes we can put into the app, which makes sense for the whole community. That's that. Daniel, it's your turn.
There's not much to say other than we all have an iPhone or an Android, it doesn't matter, a smartphone, and it's very easy to actually stand at home and make an examination of your own mouth. All you have to do exactly is just go into your camera mode, do a video. If it's on iPhone, you have to put it on the side to put on the light here. So all I actually do normally is just standing in front of a mirror. So I will just be standing here. So the light will be, I will light up my mouth like this, but just standing in front of a mirror like this. Then you can see, it will be a close-up in a minute. Then you open up the app, the way you can see the mouth map here. And that is how they look in the camera when you do it that way. That is made with a normal phone, so you don't need any special equipment at all. To examine your mouth like that, take a screenshot of it, go into the app, just make a mark where you have a visible lesion or something you're worried about, so you can actually document it that way. Put in the picture you just made. You will come into that part. In the documents of the app, you will be able to go back and see earlier lesions you had, and you can compare the pictures to one another, so you can put up the pictures to see if there's been any development in what you saw. But that was just a short way to say you can do it very, very fast yourself. You don't need anything special other than a mirror and a phone to do it.
Wonderful, Daniel. Thank you very much. So there's time now to practice this wonderful documentation.
Yes, we have prepared different settings because we know we have different people, different constellations. So for the ones which are not really experienced in this whole topic, Eunike is lifting up the paper. Please go here to this table, and then there are papers where you can take a look at and just try to read what you find, what does the color code mean, and so on. So this is when you have a sibling or some partner or a caregiver making the photos for you. You just please go over here and take one of these papers. You can also take the paper with you, and you have an instruction how to take pictures from your oral cavity. It's a training program how you can make pictures of your oral cavity. Just take one of these. Then we have a group, with a USB camera, and as you can see, Eunike, just lift up one little camera. We have 3 of them, and they are connected. We can start to connect them now. Just start the laptops. And we have one with a tablet, one with a mobile phone, and one with a laptop. And there are also disinfection papers. You can do an oral self-examination with this. And then we have here a big section where you can try to do what Daniel just described. This is another version to make pictures, and we think it's a wonderful possibility to do that. Or maybe you group together with 2 or 3 people and try to assist yourself. Daniel, I have improved your version. I bought these things. I don't know. In Germany, the name is swan neck. I don't know how you call these things. And you can start. You clip your phone in here, and you just have your hands free, so you can do this easily.
I have a question. So I noticed when I looked at this page that you were asking for many different pictures of different parts of the mouth. Is that what people should do? Because sometimes people take just the picture of the lesion, right?
So this is just to train how to do pictures. Just that you have a sense of taking pictures of different regions of the mouth. Of course, you only take pictures of the lesion you see afterwards.
It answers the question, but I remember from a conversation we had before that sometimes people do only take a picture of the lesion and you might want more. Can you explain when you might want more?
Okay. Thank you for reminding me. So we have different possibilities to take a picture of the oral cavity. Let's imagine you have a picture, you have a lesion on your tongue, here in the middle. Here, and you go really near with your camera, so near as you can, and your focus will be. So you will have a picture which is a lot of tissue and something on it, right? But when we receive the picture, we mostly don't recognize where is it? Where is the location of this lesion? So it would always be good to make different pictures, to change the angle, to go nearer, farther, maybe make a picture like this and like that to avoid reflections and so on. So thank you. So later in the app, it's always good when you document a lesion that you have different pictures of one lesion. You can put 6 pictures from each documentation into the app.